treating bronchiolitis in babies?
So treatment depends on the severity of the illness. So we have mild, we have moderate, and we have severe bronchiolitis. Mild constitutes the majority of bronchiolitis, which accounts to 80 to 90% of the cases. So mild is usually managed at home, and it can be easily managed by parents at home. So what are the measures that is actually required to manage bronchiolitis at home? Number one, as previously mentioned, bronchiolitis usually happens during the winter seasons, where the air is cold. Air is not only cold, there is less amount of humidity in the air. That leads to significant worsening of the disease. So first and foremost, a humidifier or a humidified air that can increase the humidity in the air, so that when the child breathes in, child is able to breathe slightly warmer air, which helps the child to not only breathe comfortably, but at the same time doesn't cause significant bronchospasms, which usually happens in this particular problem. That's number one. Second thing is, apart from humidified air, the second thing that we usually ask parents to do is put saline drops which unblocks the nose, because it is a viral infection and because it causes a lot of nasal congestion, and children being absolute nasal breathers until up to 6 months of age, that means children can only breathe through their noses, not through their mouth. And because they are not able to breathe through their noses, they either are very uncomfortable or they are cranky and start crying persistently. So unblocking the nostril by using saline nasal drops actually goes a long way in preventing crankiness as well as unblocking the nostril, so that they can breathe a bit comfortably. Apart from these two measures, antihistaminics can be used as and when required basis to reduce the congestion as well as make the child comfortable. Apart from these measures, it doesn't require any other treatment in children who have mild bronchiolitis. When we talk about moderate to severe bronchiolitis, we usually give the child a little bit more time, so that we know if the child is worsening, child requires hospitalization. If the child is not worsening, then can be treated at home. So usually children who are admitted for moderate to severe bronchiolitis not only have coryzal symptoms, but also have breathlessness with oxygen coming down to as low as 80s, sometimes even 70s. Apart from that, children also have a lot of breathlessness, which leads to post-acid vomiting. So these children also have a significant amount of vomiting due to cough. So in these children's, what we usually do is we give them humidified oxygen through a nasal cannula or a nasal mask in moderate cases, or we put them on something called as HFNC, high flow nasal cannula, where humidified oxygen is supplied through the nasal cannula, so that child gets the humidified oxygen. Apart from that, these help the children to reduce the work of breathing and support the child's breathing, so that child can breathe a little bit more comfortably. That's the number one support. Apart from that, moderate bronchiolitis, we also ask the mothers to feed the child in slightly inclined position, so that child doesn't cough and vomit. And apart from this, sometimes we also start them on reflux measures, so that child doesn't have the breathlessness leading to significant reflux symptoms, vomiting, retching, and leading to a lot of issues. So these are the most commonest measures that we do in moderate bronchiolitis. Come to severe bronchiolitis, usually these children either require oxygen, that is humidified oxygen, or they require HFNC. And in some children, despite these measures, children usually go on to get intubated and ventilated until the disease process settles, which can take say 3 to 5 days. Apart from these measures, we feed them through an NG tube, that is we put a tube into their nostril to their tummy and feed them, so that they do continue to get the nutrition which helps them in recuperating faster. Apart from that, nasal drops, so that the nose is unblocked, and wait and watch. Apart from these measures, there is no other treatment. That is, until unless the child has influenza leading to bronchiolitis, which has medicine to cure the disease. Rest of the viral infection do not have any silver lining or silver bullet. Like currently what we are seeing with COVID, we do not have a tablet for it. It is only symptomatic. Same way, RSV, rhinovirus, Boca virus, metapneumovirus, all of them have to be treated symptomatically, which can take 3 to 5 days to 7 days to 14 days. Apart from these measures, nothing helps. Giving them nebulizations, treating them with all sorts of medications, starting them on antibiotics is not going to help, because eventually it is a viral infection. It is a self-limiting disease. It will get better by itself. We just need to wait and watch.